Thiopentone. Thiopentone is a thiobarbiturate, which is a barbiturate in which the sulfur atom has replaced one oxygen atom. It is an IV induction agent. It is presented as a hygroscopic yellow powder, which means it absorbs moisture from the air at either 500 milligrams or 1 gram thiopentone sodium and sodium carbonate under an atmosphere of nitrogen. It exhibits ketoenol tautomerism. Within the bottle, it has a high pH, therefore it is in the enol form, the alcohol form, due to the presence of sodium carbonate and nitrogen. This increases the water solubility of the agent. Within the blood, once injected, the pH drops and therefore switches to the keto or ketone form, which increases lipid solubility. Its effects are due to the activation of the GABA-A receptors, which results in enhanced chloride conduction and neuronal hyperpolarization at dose of 3 to 7 milligrams per kilogram within one arm-to-brain circulation with broad systemic effects. These include respiratory, reduction in tidal volume, respiratory rate resulting in apnea; cardiovascular, reduction in blood pressure. This is due to a reduction in SVR and contractility with a compensatory reflex tachycardia. CNS, reduction in CPP, CMRO2 and cerebral blood flow, whilst mediating anaesthesia and anticonvulsant properties. GU, due to the reduction in cardiac output, there's also a reduction in renal blood flow and reduction in urine production, with a compensatory increase in ADH. There may also be a transient reduction in serum potassium concentrations. It's given by the IV route. It's 75% protein bound with a volume distribution of 2.5 litres per kilogram, pK of 7.6, and it's 60% unionized at pH 7.4. The offset is due to redistribution. Metabolism undergoes metabolism via multiple pathways. The major one is hepatic oxidation to an inactive metabolite, but also ring desulfation to pentobarbital, which is an active metabolite. Elimination of metabolites is via the kidneys, with an elimination half-life of 12 hours. Special conditions. It can precipitate a porphyric crisis. It's an enzyme inducer and has complications on injection. At the site of injection, patients may experience swelling and erythema, but extravasation can result in tissue necrosis. If injected into an artery, this results in a pH change, reduction in water solubility, crystal formation, and local ischemia.